Retirement is often seen as a destination, but we believe it's an opportunity to pursue your passions, realize your dreams, and live a purposeful life. Great decisions, incredible lives. Retire with Intention podcast is about more than just money. It's about embracing the things that truly matter, the experiences, the relationships, and the impact you leave behind. Here is your host, John Creekmore.
Hey everybody, John here, and thank you so much for listening in again and even watching on the YouTube channel. And make sure that if you're watching on YouTube, give us a nice little thumbs up and a like. And it's amazing how much we're seeing growth as far as on viewership, and thank you so much for that. And so here we are again at Great Decisions, Incredible Lives. And it's so amazing the stories that I'm hearing of people and the things that they're learning every single week. And I'll tell you what, it's been a blessing to hear stories afterwards. And oftentimes as I talk with people, and it's been, goodness gracious, now I'm gonna age myself. And so I started working in wealth management in 1991. And so all of a sudden it's like, wow, John, you don't have that much gray hair, but trust me, I'm that old. And it's amazing as I talk to people, we always talk about living this incredible life and make sure you have good, wise counsel. You're hearing from wise counselors. You're putting plans in place to live out your definition of true wealth. And that's all the things in life that money cannot buy. And as they're doing that, it's like there's always these potholes, these questions that come up that give me anxiety. Or I don't know how to answer that question, or how do I make this decision? It's critical to get it right. And one of the biggies that we hear about is actually Medicare. And for those folks that are really trying to navigate that solution and making sure we walk through that well, there's a lot of unknowns. And so today I am so excited to introduce you all to a new friend of mine, Danielle Roberts, and one of the nation's leading experts in the area of Medicare, been featured on NPR and Money, CBS Market Watch, a lot of different resources, phenomenal book. And so you're going to be hearing from her today, and I'm excited to be able to bring her knowledge and wisdom in that entire specific area to you all today. And so, hey, Danielle, thank you for being on the show.
Thank you for inviting me. It's my pleasure.
Yeah, love having you here. Hey, can you give a brief rundown as far as your background, introduce yourself to everybody, then we'll kind of hop into things.
Sure. So my agency is Boomer Benefits. We are located in Fort Worth, Texas, and I have a team of about 130 people that work for me there, and we help baby boomers navigate their entry into Medicare across 49 states. We are everywhere except for New York, and I've been doing this almost 20 years. It's never gotten easier for Medicare beneficiaries. They were confused back then and they're confused today. And so my team is really the answer to that. We help them with learning about the foundations of their coverage. What does Medicare provide? What does it cover? What does it cost? What doesn't it cover? And then we come in behind that and offer supplemental products like Medi-gap and Medicare Advantage, Part D drug plans. We help people navigate through how to choose a plan, what's the right plan for me, what are my needs and my budget, and where does that concern come in? And so it's a great group of people to work with. We love what we're doing. We just expanded our office space, and we're planning to grow to around 275 people. And that is to keep up with 11,000 people aging into Medicare every day.
That's truly amazing. And you mentioned Boomer Benefits as far as the company. It's also a website, right? boomerbenefits.com. Tremendous resource, everybody. Make sure you write that one down. boomerbenefits.com. Also be in the show notes. You can find more information there as far as on all the resources that Danielle has. And you mentioned the baby boomers. Is that population segment, 1946 to 1964? It's a huge, I don't know if the right word is ginormous. I'll use ginormous. It's a ginormous population segment, and one of the largest ones to ever actually go through as far as in a life cycle in the history of the world, and it's been impacting society every single day ever since that population explosion happened. And so the front edge of that in 1946, oh goodness, that's 78 years of age, and all the way down to the youngest, 1964. Those folks are 60 years of age this year. And so we're talking folks 60 up to 78. And so that's kind of that segment. Now, here's the thing, folks. If you are not in that segment, you know somebody that is, you have a family member that is, you have a parent that is. And that's why I want to introduce, we learn so much from our family members, there's so much from our neighbors. And so as you have information or run across questions or even want to say, maybe having dinner with somebody, this could be a great referral to give to them. But you had mentioned 11,000. So 11,000 baby boomers every single day are turning age 65. What are you seeing in that, Danielle, as far as, has there been an increase as far as the number of people that are reaching out to you guys?
Sure. So when we first started our business, in the very beginning, we sold a lot of group health insurance, individual insurance, and we noticed that a lot of the people that were buying those plans for us would call us back for help with their parents. Hey, do you know anything about Medicare? And initially we did not, but we got the question enough times that we decided to go and look into, okay, what is so hard about Medicare, and is this something we'd be able to help people with? And we dove in and found in that it is very complicated. When you work for an employer your whole life and they give you a health insurance option, maybe you have a choice between an HMO and a PPO, or a $2,000 deductible and a $4,000 deductible. But by and large, they're choosing your carrier and giving you very minimal products to choose from. And that's how it goes. And then you turn 65 and you're thrown into the world of the National Healthcare Program that has been around since 65 and still operates like it's in 1965. It has 4 parts, 10 Medi-gap plans, 40 or 50 drug plans in every state and county. It's no wonder that people are
Mm.
confused. And so, what I love to hear is that you have people that tune into your podcast even earlier, because really you should be starting your thoughts about Medicare well before. If you can start learning about it when you're 60, you're ahead of the game. But even if you started learning about it just 6 months before you enroll, you'll have a lot more peace of mind when you get to that date and you have to activate your Medicare, because
Mm.
it's a complex topic and you want to really understand what you're getting. This is a thing that's going to take care of you if your kidneys fail and you need dialysis, or you get cancer and you need radiation, or you have a stroke and you're recovering in a skilled nursing facility. All of these are things that we hope will never happen to us, but we know as we age, we need to have something solid in place so that we have the best opportunity for recovery, because we've got good health care to help us when that does happen.
Mm. You used the word complex, and I think the other one's confusing. Why is it that Medicare is so confusing and complex to so many people? Is there a reason why it's so confusing?
Well, back in the day, there was Blue Cross Blue Shield was the primary health insurance coverage in the United States, and they had hospital coverage and outpatient coverage. And so Medicare followed that model. And, 50 years later, health insurance is a lot more than just that. There is mental health care, there's dental care, hearing care, vision care, but Medicare is still back in 1965. And when they want to include something, they tend to add on pieces. So, for example, Part C is the Medicare Advantage program, Part D is the drug program. So now, besides just the original stuff that we need to figure out, now we have these optional parts, and we have to determine whether it makes sense for us financially to enroll in them now or later. And also, the parts that you enroll in depend on your working. Well, back in the 60s, most people were going to be retired at age 65. And that has completely changed today when we are in a digital generation and people can work jobs that are more sedentary. It's not unusual for us to have people first come and talk to us about Medicare when they're in their mid 70s, because they've delayed their enrollment until such time they wanted to continue working. They were stimulated by that, or they loved their jobs. And for some people, they continued working because it was really necessary for income. And so when you have extra pieces added onto a product that's already confusing, that makes it even worse.
Mm. It's just so interesting. There's so many questions people have. And, a couple minutes ago, I was actually on the website boomerbenefits.com that's tied to your company, Danielle. And I was over the far right-hand side on the drop downs, there's the frequently asked questions, the FAQs. And I thought, man, what a phenomenal place for people to go to. I was just looking at the questions there. It's almost like the top 10 questions that I hear from people, and they're all right there with complete answers that are out there in layman's terms and not this really complex language of Medicare. It brings it down. It makes it so simple. And when I was looking, I thought, man, there's so many challenges for people that are really new enrollees in Medicare, or maybe they're ones that are getting ready to head in Medicare. So many challenges there. Can you think through, like, what are some of those biggest challenges that new Medicare beneficiaries kind of go through whenever they're first learning about Medicare?
Mm-hmm. Well, when you have your health insurance your whole life, you have a couple of different types of costs. There is premiums that you pay for the insurance. Maybe you pay a portion and your employer pays a portion. They deduct yours out of your paycheck. So there's that. But then there's costs that you spend at the doctor, hospital, any type of provider, lab facilities. And really, Medicare is the same.
Hmm.
So it can seem overwhelming because it's administered differently. And when we were working, we didn't have the terms A and B, but really you did have inpatient coverage and outpatient coverage in your insurance that you've had your whole working life. and you also had premiums that you paid, and you also have cost sharing when you use your benefits. And so to make it a little easier, Medicare works exactly the same way. There are premiums associated with Medicare Parts A, B, C, and D. We can certainly go into those. And then there are costs that you're going to pay as you use your benefits. It's surprising to me how many people still come into Medicare without any knowledge that it costs anything at all. I've seen that catch people totally off guard to where they go back to work for a few years because they were not prepared. And we've also seen people coming in thinking that they're going to pay the base rate for Medicare Part B and get caught off guard by the fact that their income actually means they're going to pay more for that. So, can you just imagine you leave this comfortable place where you've worked and all of this was done for you, and then suddenly you have to figure all of this out. This is something that almost paralyzes people to where they have inaction. They don't want to do anything, which of course then can result in penalties. So I have a lot of empathy for what people are going through when they're coming into this. And those are some of the reasons why it's just so challenging.
Yeah, you had just mentioned A, B, the whole alphabet soup. Can you kind of walk through everybody what's covered in those different letters and what do those mean?
Mm-hmm. So Medicare Part A is your inpatient hospital. You want to think of this as room and board in the hospital. It's going to be a semi-private room, doctors and nurses that come around to provide you care, 3 square meals a day. Maybe you get some yummy strawberry jello. That is your inpatient. It also covers things related to an inpatient stay, like medications that are part of your inpatient stay. If someday, if you need hospice, Medicare Part A will cover that. Maybe you've recovered in the hospital, but you need to go to a skilled nursing facility for a few days because you need some physical therapy or wound care. And Part A is going to cover all of that inpatient piece. Part B then comes in and covers outpatient. Now, you and I think of outpatient benefits as lab work and preventive care, but there are many things that fall under Part B. It could even be something that happens on a hospital campus, but because a physician performs it on an outpatient basis, it falls under Part B. So we have durable medical equipment, medical supplies, doctor visits, specialist visits, dialysis, chemotherapy, radiation, ambulance rides. There's a whole host of things that fall under Part B. And Medicare only covers 80% of those costs that fall under Part B. Then there are things like deductibles, copays, and coinsurance that you pay in addition to that. Once you have your foundation set up, which is original Medicare Parts A and B, then you'll be making a decision based on whether you're still working. So assuming that you've retired and Medicare is going to be your primary coverage, you'll be deciding, after I have my A and B all set up, will I want to go one of 2 routes? We can go with a traditional Medicare supplement called a Medi-gap plan or a Medicare Advantage plan. And that is the thing that's going to help fill in some of those gaps. So Part C is the Medicare Advantage program. That's optional. It's a way for you to get your Medicare Part A, B, and D benefits through a private insurance company that operates a network in your local area. So it limits your access to providers some, because instead of being all of Medicare providers, it's going to be the ones in that network where you've chosen that you live. And Part D is the newest part of Medicare. It was rolled out in 2006. Prior to 2006, I had people paying $10,000 a year for their medications. If you have diabetes and you need some expensive meds, you were robbing Peter to pay Paul. And Part D came out and fixed that. It's not perfect. It certainly has its challenges, but it did greatly help people with the cost of outpatient medications.
So all of a sudden then I was just thinking, as far as the cost, you said that some people think that there's no cost on the Part A and B at all. And then you'd also said, boy, if I make too much money, that might affect things. And I just had I'm going to say a triage case where a new client came into our wealth management firm and they had just completed a Roth conversion. And all of a sudden that jacked up their income in 1 year. And so they're at they're paying a lot more on their Medicare. For everyone, just to kind of, since it was brought up earlier, can you kind of walk through what that is? And I know they love initials, right? And so we have all these different things. Can you kind of walk through that as far as educate people on what that piece is?
Yeah, of course. And it's a great thing for you to be aware of as you're coming into Medicare, because choices that you make in your 63, 64 can affect you when you're 65, 66, and beyond. So we all know that in America, when you earn more, you get to pay more. You pay more in taxes and you also pay more for Medicare. So in my industry, we call this meeting ugly Aunt Irma. She is the income related monthly adjustment amount, or IRMA for short. And this means that when you're rolling into Medicare, the IRS is going to send your tax records over to Social Security. Social Security is the entity that enrolls you into Medicare.
Okay.
They are going to pull that tax return from 2 years prior. So in 2024, they'd be looking at your 2022 income. And they are going to then send you a benefit determination letter in the mail that says, here's what you earned, here's what you'll pay for Medicare. Now, most people are going to pay the standard rate, which is $174.70 a month in 2024. And the vast majority of Americans pay that. Some people pay less if they're eligible for Medicaid, which is a form of insurance for people with very low incomes who have qualified for state or federal assistance. But on the other end of the spectrum, you have folks out there who are what they call high income earners. So if you earned more than $103,000 as a single filer or $206,000 as a joint filer, they are going to put that into a little chart. You can find this chart on the Boomer Benefits website, and they will say, here's what you're going to pay. So maybe instead of $174, you're going to pay $239. In fact, the highest bracket is around $600. So just imagine that you came into Medicare either not knowing there was a premium or thinking everybody pays $174. And now you find out that because of your income, or maybe you took a severance, or you did that conversion of your Roth IRA, or you sold a piece of property and had a really high capital gain on it, you'll be surprised that you get this bill from Social Security. Now, they look at this every year. So the following year, when fall comes around, they're going to go back and pull the next tax return for 2023, and they're going to send you a new benefit determination letter in the mail, usually in December or January, saying, here's what we've calculated that you're going to make for next year. So if you had that income pop and just hit the 1 year, you might have just 1 year of high premiums. But also, you may have had a significant change in your income due to retirement or going full-time to part-time. You maybe had a marriage, divorce, death of a spouse, sale of an income-producing property. Any of those will actually qualify you for the right to appeal. And you can pull this at my agency when we're working with someone coming into Medicare. We provide all these forms, but you can easily find the appeal form online. It's SSA-44. You can Google it, and it will tell you, here are the reasons that are valid for an appeal. Tell us which reason belongs to you, and then provide documentation. So you mail that in. A human being at Social Security will review that, and they can adjust it down sooner so that you don't have to wait the 2 years for that new lower income to catch up. And that's probably the most important tip that we can give to people, because we see people unaware of this that pay that higher premium the whole time when they could get 2 years of that minimized just because of the appeal form.
Yeah, that's great counsel. And so many people, our financial lives are so complex. There's so many moving parts. And oftentimes we don't recognize that one decision actually might have impact on 4, 5, or 6 other things. And so as folks are going through, we need to consider that. So all of a sudden then, Danielle, let's say someone is 64 as an age, just turned their 64th birthday. And so they are all of a sudden coming up to that age 65. I guess the first question is, how soon should somebody start preparing for Medicare decisions? And then what are some ways that they can actually start to think through, how do I be best prepared for those decisions?
The best time is at 62, so that you can work with your financial advisor when you're 63 and 64 if you're high income, for sure. Now, if you're not in that category, you could get away with waiting until you're 64 or 64 and a half. But your eligibility for Medicare, you have a 7-month window surrounding your 65th birthday. So you can enroll in Medicare up to 3 months before your 65th birthday month. And that's really the sort of the bare minimum. The complex terminology makes you have an advantage if you learn it sooner. So while it may not be an exciting topic, it is something that once you get a grasp on it, you can make sure that you don't make a wrong decision, that you don't end up with a penalty because you forgot to enroll in a part that you needed to. So we say the best way to educate yourself is to go online to Medicare.gov. Their website has had a complete revamp in the recent years, a lot of great information there. You can also seek out sites like ours. We do a Medicare 101 webinar with yours truly several times a week. It's a free webinar where you can come in and we go through in a deep dive with all the information on the screen in front of you, what you need to know. So we talk about costs and coverage, the different types of plans. We talk about when you should enroll if you're working for a small employer versus a large employer. What about people that have COBRA or TRICARE for life or federal employee health benefits? We kind of hit all the high points. And then after that, you would reach out to someone like a person on my team who's been doing this for years, and we can fill in the gaps. So you're going to come out of a webinar like that, and at the end of the webinar, there's at least 100 questions every time. And I will answer them for a good 30 minutes or so, and then maybe we run out of time before we answer your question, but that's okay. We're going to give you a resource. You can reach out to my team. Our service is free, so people can call and ask as many questions as they like. Now, if you're not a webinar person and you're a reader, there are several great books about Medicare out there. Mine is one of them, but you can find others as well on Amazon. So maybe you don't learn best in an audio-visual environment. Go ahead and read a book, write your questions down, and that's when you want to reach out to someone to help you with answering questions. So you'll get your basics down, and then you take the next step.
Daniel, you had referenced your book, and I'll tell you, 10 Costly Medicare Mistakes. That is a phenomenal read. I think it should be everyone's first read whenever they get into that age period of age 62. I'd encourage everyone and go on. You can order online on a website, but also, there's other resources to get it. Guys, if you are having trouble finding the link, we'll put the link as far as to order the book. It's a phenomenal resource for all of you. That's one of the first places to start. Dan, I was thinking, you're the classic entrepreneur. You started a business and been extremely successful. And we have so many listeners that come here that listen to our show, not just in that 60 to 65 range, 60 to 75 range, and even a lot that are still entrepreneurs. Can you kind of walk through a little bit, pivoting a little bit in conversation, but what are some of those, key decision points or maybe key habits that you see that need to be there for a successful entrepreneur?
Well, I think the first one is discipline. So when I look at agencies over the years that I have seen, or agents that have not succeeded, a lot of it has to do with just sheer discipline. My brother and I own our business together. It's a family business. And our kids, as we were kids, my dad was an entrepreneur. So we learned that from him. And maybe you could say we have the bug. But one thing that we're both very good about doing is we're persistent and we follow the things that need to be done. So, in any industry, there's going to be some sort of sales that maybe is not your.
Hey, Dan, just to pivot a little bit, Danielle, I was just kind of thinking about it. You are like that classic entrepreneur. It's incredible to see your business, to see how it's grown, and just the massive impact you guys have had nationwide in so many people's lives. Can you kind of walk through a little bit as far as as an entrepreneur? Is there some key points or key habits that need to be there for someone to be a successful entrepreneur?
Sure. When I look at the industry that I work in, and having seen many agents come and go over the years, a lot of it comes down to discipline. All startups have tasks that are more fun than others. So I remember this very well. When I started my business, I didn't have cash. And so what I did was I use elbow grease. So I would drive out to industrial business parks, walk in the front door, ask them if they had group health insurance, do they have an agent? When their date comes around, could I quote it, leave behind a card? And I would do that day in and day out. It was a way for me to get in front of people. And sure enough, a few months later, we might get a phone call. We started providing some group insurance. And then we were able to, as our income grew, we were able to reach a point where now we don't have to do things so hard. We can buy those leads generated by companies that are specializing in that. And so in the early days, especially, a lot of it has to do with discipline, but also you have to find an angle if you want to separate yourself from the crowd. And I say this all the time because any insurance agent could sell you a Medi-gap policy. Anyone can, but what makes them special? What would make us stand out? So for us, we decided when we looked at Medicare, we realized that people are having enough trouble getting enrolled, but then after they get enrolled, there's all sorts of problems that happen with Medicare. So they might have a prior authorization that just gets lost in the black void, or it pens and pens and pens and nothing is happening. You might go to the pharmacy at 4 o'clock on a Friday for a very important medication and be told that your Part D company is denied it for step therapy. Well, what does that mean? And you also will get bills in the mail that you think should be covered. You're not sure if you owe them, but who do you call? Would it be your doctor? Is it Medicare that we call? How about the insurance company? And so people were just completely lost. And we decided to create old school customer service. So you're going to call us when that happens. You don't have to call Medicare. You don't have to call anyone. You call us first, tell us what the problem is, and then we go shake that down. But in doing this, we have just fell in love with our clients because it was so amazing to be able to meet the need of someone when there's a tough product. So if you're out there starting a business, even if it's a business that lots of other people do, what is the angle that you can create that makes you unique in your offering. And then, of course, you need to get involved in marketing. One of the things that I've done at my business that I think has been the most successful is I don't hire anyone for a job that I haven't done myself. So in the beginning, I learned all the marketing myself. I learned all the Facebook ads. I learned the Google pay-per-click. And then once I had mastered them, I hired an expert who was better than me. But now that expert in my marketing team or wherever, sales team, service team, whatever role they were in, they can come to me with a question and I can give them a very valid answer because I have stood in their shoes and I know exactly how it is to do that role. And that for us has been something that has really been successful because when I'm creating a new training class of agents that are getting ready to start for me as an employee, I can go in there and say, I have been on the phones, I have done this selling, I have made the calls, I have sold the policies, I understand X, Y, and Z about how you will feel about your job, and I'm here for you. So when you're going through your journey with our company, if you hit a snag, my door is open, come and talk to me. I know what it's like to do your job. For us, I think that has been one of the things that sets us apart the most because a lot of people want to hire out things that they don't know, that then they have trouble communicating with their team and understanding what their team members are telling them because the terminology is just, the lingo doesn't work for them. So if you can get in there and figure it out yourself first, you don't have to be an expert, just get enough knowledge under your belt and then hire someone that's better than you.
Yeah, I love that. That's a phenomenal storyline, just of an entrepreneur that said, hey, I love this. I'm going to find there's a big problem. I'm going to find a solution. We're going to deliver it in a way that makes sense. And we're going to fall in love with the clients that we serve. And we're going to serve them in unbelievable ways, unbelievable levels, and tremendous story. And I'll tell you what, I know that I'm still 11 years away from Medicare. I wish I could enroll in Medicare now so I could work with Danielle and start with her firm. And so, you guys, I want to tell you, Danielle, thank you so much. All of a sudden, I looked at my clock and it's like, man, where's time gone? I feel that I've gotten a college master's level course as far as on Medicare, and they did a great job. And I'm sure it had impact on so many people's lives. And everybody, I do want to refer you over to the show notes. And we have links in there for Danielle's book. We have links into the website. And so phenomenal tools, phenomenal resources. And as you're navigating things with friends and family and even yourself, questions on Medicare, encourage you to reach out to her and her firm, and they'll be able to help you along the way. Danielle, again, thank you so much for spending time with us today. It's greatly appreciated.
My pleasure.
And everybody, thank you so much for sitting with us, and look forward to hitting with you next week right here on Great Decisions, Incredible Lives. And here in the next week, take the information you've learned and go out and make an impact in the world where you sit. Talk to you all later. Bye-bye.
Thank you again for listening to the Great Decisions, Incredible Lives, Retire with Intention podcast with host John Creekmer. Follow us on social media, visit our website, and join our community of like-minded individuals redefining retirement and living incredible lives. Please leave us a review and share our podcast with others who may benefit. We wish you a future filled with purpose, fulfillment, and the joy of living your incredible life in retirement.